Good afternoon. I'm Dr. John Vena from the Medical University of South Carolina, and peace and greetings from Charleston. Sorry that we could not be together and with you all in Zagreb. I would like to review for you today the population health initiatives on aging and health and our system sustainability and some of the things we're doing to promote healthy longevity. I'd like to recognize my co-authors, Dr. Phil Smeltzer, who is coordinating the Public Health Institute here at MUSC, and Dr. Ron Gimbel, Chair of the Department of Public Health Sciences at Clemson University, and Dr. Hermes Flores, the Professor and Chair in the Department of Public Health Sciences at MUSC. So the future of public health and population health is really dependent on our commitment to broadening our understanding of biology and behavior, medicine, methods, and management, environment and economics, policy and programs. And it's quite evident, especially in this era of the COVID pandemic, that the U.S. medical care systems need to be changed dramatically and be more focused on population health. So the renewal of a vision of health and well-being for the whole community is really what's necessary. There must be a commitment to the values that shape that vision. And what this entails is developing partnerships between public health scientists who work as part of the public health teams in both academic medical centers, federal agencies, and most importantly in state and local health departments. We also need input from community and international organizations, and that it'll be key to our future for addressing population health. So I'd like to present now the concept of a Population Health Institute. This came about by the formation of a task force chaired by Dr. Smeltzer and was formed to examine the benefits and barriers of a public health institute at MUSC. The problems to be resolved were that the current medical service consumption was way too high, and the cost trend must be reduced by millions of dollars, and to avoid a current $1 million per year penalty payments. Again, this is in the kind of flawed U.S. medical care system and how it's organized. The other thing that the Institute needs to address is the need for additional training of both staff, faculty, and administrators and provide population health knowledge insights and train the healthcare team. Training is now diffuse and lacks a strategic approach. So we need to address that. So what we want to measure is performance in the future in generating a reduction in medical services consumption, yet at the same time providing population-based care and prevention. And the other outcome that we want to assess is how well do we do in academic and training courses available for students and healthcare team members. And our goal is that 80% will be complete some basic training in population health. MUSC is an ever present in one's health journey, from being born to college and then starting your own family. But then as you get age, again, healthy aging and increasing longevity means that we have to address chronic illness exacerbation and have early detection and prompt treatment. And then there must be specialty care, and then as we age even further, palliative care. And so during this COVID pandemic, it has become increasingly clear that even on the short term, there has to be procedures in place to address incoming and approaching problems. So we've come up with this population health logic model, And I know this is a little complicated, but just briefly say that we address who and what type of factors, where that would occur, and the data needed to be generated. So we have our care teams, and then that are supported by a network and data analytics, and then our market member teams in taking care of care episodes and the care continuum in health management. And on this side are our goals, which would be generate savings and improve health. And so again, setting up a milieu of factors, and including the Population Health Institute will communicate, and a big portion of current response, especially in the area of COVID, is our ambulatory clinics, but our telehealth and digital health. We've set up virtual visits, for example, and we are one of 2 national centers at MUSC in telemedicine, centers of excellence. So our mission is to provide interdisciplinary and interprofessional environment supporting improvements in quality of care, patient experience, medical provider experience, and reducing our medical expenses. So the Institute would facilitate a successful transition to value-based care, integrating efficient, systematic approaches at all levels of the patient experience. So this healthcare landscape includes coordinating the delivery of information, insights into subpopulations in the region, and then community and clinical actions that would address perhaps specific segments of the population, certain age groups, socioeconomic groups, people with certain health status, etc. So our vision is coordinating innovative approaches to population health across the enterprise to improve the health in the daily lives of population we serve through coordinated, innovative approaches. So as a world-class innovator, we drive improvements across the spectrum of population health approaches. And so we want to coordinate university-wide research efforts to help support this, including data analytics, big data insights, predictive modeling, comparative effectiveness research, and novel delivery of care interventions. So our organizational relationships is that we have collaborative clinical centers of excellence, and including mental health and pathology, radiology. Then we have those that are again focused on patient-focused treatments. But one of the things we want to develop is a medical neighborhood. And so the Population Health Institute organizational relationships is that, again, the Institute will help data-driven decision-making and knowledge sharing across the enterprise. And most importantly, we will have training and education, including student projects, healthcare team member training, and then academic programs in population health, including perhaps the development of a Master's of Public Health in Population Health. So the evolutionary cycle, again, this is adapted from Metro Health Population Health Innovation Institute as an example, where you have cost control and innovation in care models in the center, payment reform, you establish population registries, you establish clinical practice guidelines, and then both knowledge management and quality improvement. And with, again, with our data analytics, again, assess and transform what we're doing, and then, again, have community involvement in this process. Another example that you could look into is, again, Healthy Communities Institute. There's a website here, healthycommunitiesinstitute.com. And again, unlock data, gain knowledge, focus resources, measure results. Again, this is another example of how you could approach this. At MUSC, one of the things we set up is preventive health services, especially those who are our own patients through MUSC Health, adult preventive care recommendation age bands, and we have it both for male and females, and we've selected 16 tried and true prevention measures that we want to make sure we implement as much as possible. So there's cancer prevention, heart health, immunizations, behavioral, and prevention. And these will provide really big impact for low cost and help set up prevention and make sure that we increase longevity and help with healthy aging. So again, the structure is that we have the patient and our nurses and doctors and front office support and specialists and diabetes and CVD team. And then, of course, there's referral to the health educators, pharmacists, case managers, and then social workers that we can then have community-based approaches and then work with the health department clinics, and then also some, again, preventive activities. And again, we monitor this all through our EPIC documentation, and that will, again, fit into our model of our Population Health Institute. So our pipeline milestones are that, again, the medical neighborhood is formed, and we will target the patient target lists. We'll develop dashboards, team expansion, and then have data-driven decision paths. And then, again, over the next 2-3 years, hopefully, we will have this up and running. So the Population Health Institute will collaborate in university-wide research efforts, including data analytics, big data insights, predictive modeling, comparative effectiveness, and will facilitate transition to value-based care. And community and clinical actions may include, again, addressing specific subpopulations. In the next session, Dr. Ron Gimbel will provide a high-level overview of a rural health innovation partnership in South Carolina that will engender healthy aging. And then Dr. Hermes Flores will review how we are addressing in South Carolina the challenges associated with increased lifespan and growth of the older population, and how our team wants to enhance the implementation of evidence-based interventions. And I'm pleased to say that now we will proceed to session 4C. We'll proceed to session 4C, community-based approaches in medical wellness for healthy aging, and includes 2 papers from Jagiellonian University, one on the role of senior councils and the other one about a pro-health 65-plus project. And then there's a really interesting project from Greece looking at obstacles in an industrial environment. So thank you for your attention and best wishes.